Members' motion with no legislative effect. Members who wish to speak, please press the Request to Speak button. This Council will debate on Reverend Peter KOON's motion on formulating a comprehensive homeless-friendly policy to build a caring and inclusive society. Ms. Ginny MAN will move an amendment to the motion. This Council will proceed to a joint debate on the motion and the amendment. I will first call upon Reverend Peter KOON to speak and move the motion. Then I will call upon Ms. Ginny MAN to speak, but she may not move the amendment at this stage. The joint debate now begins. I now call upon Reverend Peter KOON to speak and move the motion.
Reverend Peter KOON. President. In Hong Kong, a busy international city, there is a group of people who are forgotten and who are marginalized. They are the homeless people. They lack a shelter and they face the plight of poverty as well as mental health issues and as well as unemployment. Their home is perhaps a bench in the park, a narrow back alley, or even a corner of a 24/7 fast food restaurant. We are like living in parallel universe with these people. According to statistics, in year 2025, there are about 750 registered homeless people. Lower than 1,400 people recorded in 2023. Is it that we have fewer homeless people in Hong Kong, or is it that there are actually more homeless people, but we just haven't been able to reach them? There are complex reasons behind the issue of homelessness. It could be personal issues, financial problems, or broken families. There are also structural problems behind, such as housing, underemployment, and so on. However, there is fragmented support offered by the government to the homeless. There is a lack of central coordination. Different departments see their work overlapping each other, and there is also a service gap in terms of the support offered by the government. Some departments, when dealing with homelessness issue, they forcefully drive away the homeless people, and these will not be able to address the problem at root. We must admit that homelessness problem is not attributed to individuals. Instead, it is a long-term and a long-standing issue of our society. If we continue to ignore the problem, it will just get worse. With an aging population in future, we may see an increased unsheltered population. So the government must face up to the problem squarely in order to help the homeless people return to their homes. We also have to cope with any potential increase of homeless people. To provide support to the homeless, we must offer accommodation to them. Currently, street sleepers can stay in short-term accommodation for 6 months only. This kind of short-term accommodation will not help the homeless return to a stable life. I hope the government will allow the homeless people to stay in this kind of short-term accommodation for 2 years. The government should also improve the living environment of the short-term accommodation. For example, the living space per capita should be increased. There should be a healthcare room as well as counseling services provided for the homeless. Also, a number of homeless people face mental health problems as well as drug issues. I hope the government can study this. Are there any ways for us to provide a one-stop rehabilitation services for the homeless? We should, on a continuous basis, provide counseling support as well as drug cessation services. We need to provide comprehensive support to the homeless to help them address the problem. Also, we need to provide healthcare as well as mental health support to the homeless. The homeless people have dire needs in this respect. according to survey, over 90% of the homeless people suffer from certain healthcare issues. They also have financial problems, and therefore they cannot go see the doctor to cure their mental health problems. About 20 to 25% of the homeless people in Hong Kong are diagnosed with mental health problems. They have suicidal tendency as well. However, currently there are only a small number of psychiatric nurses in Hong Kong, and there is a lack of outreach support for homeless people. There are many outpatient clinic services in Hong Kong that require citizens or residents to provide living addresses. However, the homeless people will not be able to provide this kind of proof. Will the government consider relaxing or removing these relevant barriers and restrictions so that the homeless people can have access to the healthcare system in Hong Kong? Also, we need to support the employment of homeless people. We need a comprehensive plan. I suggest that the government work with social organizations so that we can provide career and life planning, as well as improve the skills of the homeless people, so that homeless people will be able to find a job. At the same time, we should offer training to employers so that the homeless people in Hong Kong can slowly and progressively build their career. Lastly, I'd like to stress that it is important for us to remove the labeling for homeless people. Many people stigmatize the homeless as lazy people and irresponsible people. All these labels will only hinder the homeless from reintegrating into our society. Through school education and publicity, through different media channels, we should enable the public to have a better understanding of the homelessness problem so that we can build a caring and inclusive society. Around the world, in many different places, there are targeted policies that support the homeless people. For example, in New York and Tokyo, there are dedicated government departments that help coordinate policies to support the homeless. In Japan, starting from 2002, there was legislation that promotes the employment for the homeless. I think we can learn from this experience and set up a committee to study homeless-friendly policies. There should be a dedicated department to serve as the coordinator. The committee should help track data as well as to coordinate the efforts of different departments to help the homeless. I hope that the government can break the relevant barriers so that we can face up to the problem together. I'm most concerned about the change of our demographic structure. The change of our population may lead to a sharp increase of the number of homeless people in Hong Kong. There is such a situation in other places in the world. Actually, in Hong Kong, many NGOs are following up on the problem of homelessness. I hope the government will not simply allocate resources to the homeless people. Instead, the government should listen to the views of all these organizations that are supporting the homeless. We should not simply rely on the government to solve all the problems. We should bring together the wisdom of our community. I understand that the problem of homelessness cannot be addressed overnight, but we shouldn't escape from the problem just because it is a complicated issue. It is an inevitable issue, and we all realize that there is such problem through TV programs, for example. I hope the government and the relevant bureaus will reach out to the NGOs that offer support to the homeless so that we can find a way to solve the problem. It is not that the problem will be solved after this topic is discussed today. I hope the government, however, will come up with a solution as early as possible so that we can follow up on this on a continuous basis. As a member of the LegCo, I'd like to help solve the problem. While we don't have a huge population of homeless people in Hong Kong, but they need care from us. We want to be able to show them hope so that they understand that there will be light at the end of the tunnel for them. I hope the government will formulate policies to provide care for the homeless so that we can help them get out of the plight. I so submit.
I now propose the question to you that the motion moved by Reverend Peter Koon be passed. Ms. Ginny MAN. Thank you, President. I'd like to thank Reverend Peter Koon for moving the original motion. Now, for the homeless in Hong Kong, we're referring to street sleepers who stay in temporary shelters or caged homes or living in inadequate living conditions. Now, our understanding of the homeless people usually mean they sleep on the street, and we have the perception that they must be the failure of society, as they don't even have a roof over their shelter, over their head, and that they are lazy, they're layabouts, and all these negative perceptions impact on the homeless people. Now, according to statistics, many street sleepers do not have a home because of health issues, because they cannot pay for the rent, and they are perceived as the layabouts if they don't have a job. And because they do not even have mobile phones or home address, they can't even fill in basic information in application for various assistance schemes. They have problem finding a job or seeking medical help. So I think we need to destigmatize homeless people and help them lead a life of dignity. And the public should also be more tolerant, and this hinges on the government's public education policy. We should take a people-centered approach, and we should be as inclusive as possible. We should not take the broad brush approach in removing their articles on the street, and there are also policies that are not friendly to street sleepers, such as the arms of on the benches in parks. In a way, you're evicting and driving away the homeless people from the parks, and they have nowhere to stay overnight. And that, as a result, the integrated service teams find it difficult to approach them. They have no means of contact. It's difficult to gauge the situation. According to the statistics, over the years, the number of street sleepers have continued to decline, down to 750 in 2024-25. But in fact, the actual number of street sleepers might be far more than that. We can make reference to the approaches taken by places such as Taiwan. They will dispatch property to street sleepers, and there'll be designated staff to watch over their properties. Now, in New York, a part of the park will be set aside for street sleepers to stay there. Now, for some of the street sleepers, they may be torture claimants. They have their own cultural background. They speak another language. There is a need to enhance support for NGOs that provide outreach services for the homeless people. According to a survey conducted by a university, many of the street sleepers were victims of abuse. They also suffered mental health issues. They are helpless. We need to help them. Emotional support, such as counseling services, should be provided to help tide them over the family problems. They may even suffer from psychological traumas. They end up living on the street. But as I said, there are barriers. The government should address the barriers and strengthen emotional support for the homeless. There should also be counselors deployed to the reception centers. I fully support the original motion, and that the religious bodies and NGOs should participate in the process. Charitable organization likewise should help run these temporary shelters for the homeless. They can provide psychological support and counseling services to them. Charitable organizations that have participated in district services can also help run these temporary shelters, and that is why in my amendment I propose encouraging charitable bodies as well to participate jointly in establishing the support network. I urge members to support the motion and the amendment. I so submit.
勞工及福利局
Secretary for Labor and Welfare. Thank you, Deputy President. I would like to first of all thank Reverend Peter KOON for moving the motion on formulating a comprehensive homeless-friendly policy to build a caring and inclusive society, and Ms. Ginny MAN for her amendment. This debate gives us a valuable opportunity to exchange views and explore how best to support street sleepers as we work together to foster a caring and inclusive society. Street sleeping is a complex social issue. It cuts across different bureaus and departments. It involves housing, welfare, and healthcare needs of street sleepers. It also involves coordinated cross-departmental action at the district level. Government departments and district service units have all along worked closely together, not only to provide appropriate support for those in need, but also to address together district issues that may arise from street sleeping. On the welfare support for street sleepers, the Social Welfare Department, that is the SWD for short, subvents 3 integrated services teams for street sleepers operated by non-governmental organizations. The teams conduct daytime and late-night outreaching visits, proactively engage with street sleepers to gain insights into their reasons for homelessness, and provide integrated services in light of their actual needs and willingness to receive assistance. The SWD also subvents short-term hostels run by NGOs to provide transitional accommodation. Through counseling and advisory services, street sleepers are assisted in transitioning to more stable housing arrangements. People sleep rough for different reasons. These include unemployment, a lack of accommodation owing to rising rents, the breakdown of family ties, and the lack of a fixed abode for those who are discharged from hospital, released from prison, or a drug treatment center. Some individuals are struggling with unstable financial conditions. Some prefer staying close to where they work and potential job opportunities. Some lack a drive to seek a roof over their head because of mental health issues or drug abuse. And some wish to stay in a community with which they are familiar. When their difficulties or housing problems are resolved, some choose to move off the streets and reintegrate into society. The SWD, together with its subvented integrated services teams and service units, will continue to provide support according to individual circumstances, meeting urgent welfare needs and helping them transition out of street sleeping and back into the community. At the district level, government departments and service units have worked closely and actively. They also participated in cross-departmental operations coordinated by the district offices. These efforts are carried out in a compassionate, empathetic, and humane manner. On the one hand, we attend to the needs of street sleepers. On the other hand, we tackle local hygiene concerns. For instance, the SWD works with NGOs and the integrated services teams for street sleepers to conduct proactive visits, find out why they are forced into homelessness and what they need, strengthen counseling from multiple angles, and identify and address welfare needs at an early stage. The motion today covers a wide range of issues and policy portfolios, as mentioned by Reverend Peter KOON and Ms. Ginny MAN. These include housing, welfare, and healthcare support. It also involves cross-departmental coordination at the district level. My colleagues and I will carefully listen to members' views and suggestions, and then we will respond accordingly in our concluding remarks. Thank you, Deputy President.
Mr. Zhu Lapwai. President, I speak in support of the original motion. I thank him for moving the motion. I also support Ms. Ginny Man's amendment. Now, if you search with this keyword, homeless people, online, then the search result will immediately display figures relating to the number of street sleepers and the services provided by the Social Welfare Department. However, homelessness includes a much wider concept. It includes those living in interim accommodation, temporary shelters, and those in caged homes. However, the government does not keep statistics about the homeless people using the definition I mentioned. And that means, in a way, we do not have a full grasp of the situation. And that is why I'm proposing the following. In order to improve and formulate a comprehensive homeless-friendly policy to build a caring and inclusive society, the government should first and foremost have a full and accurate grasp of the data relating to the homeless. Only by having a clear definition will we be able to collect accurate data and formulate policies to tackle the problem in a precise manner. If we shun the problem, ultimately, these homeless people will eventually sleep on the streets, and there will be a much heavier price to pay for the whole community. The government should also study ways to keep them off the streets so that they can have their own home. According to statistics in 2024-25, there were 750 street sleepers. That's a drastic drop comparing to 1,500 street sleepers 5 years ago. I appreciate the efforts made by the Social Welfare Department and other government departments. Now, 750 street sleepers, however, is not a small number. Each of them come with their own background and their stories and why they end up in the streets. That is why we need to take a more precise approach in identifying them and providing them with services. Now, we rely on the Social Welfare Department under the current system. The Social Welfare Department, however, takes up a very wide portfolio. In relation to support for street sleepers, there might still be room for improvements. There are only 3 integrated services teams for street sleepers taking care of all the street sleepers in Hong Kong. I don't think it's sufficient. Now, these 3 teams cater for the needs of street sleepers in the whole territory. One problem is, for example, that the Hong Kong island is combined with other outlying islands, and this is only served by 1 integrated services team. Now, in terms of street sleepers, it's really difficult to have 1 team look after such a wide area. Meanwhile, I understand that resources are limited. It may not be possible to set up teams for each and every district. Still, the government should consider establishing more teams, and there should be a collaborative efforts by more government departments to solve the problem together. In fact, other government departments can also chip in, including frontline police officers, FEHD colleagues, Highways Department, Home Affairs Department. Their daily operations also involve street sleepers. In fact, data can be collected at the front line and provided to the street sleeper platform operated by the Social Welfare Department. I believe by doing so, the integrated services team will be able to better follow up on their cases, and that more precise help can be given to street sleepers in the community. I support the motion for the homeless to be included in society. Mr. Kissenyao. Thank you, Chair. Thank you, President. I thank Reverend Peter KOON for moving the original motion on formulating a comprehensive homeless-friendly policy to build a caring and inclusive society. The government has been joining hands with NGOs on this matter. For example, the Social Welfare Department operates outreach teams, and they work with the NGOs in providing employment support and accommodation places for the homeless. They have a network. In fact, the number of registered street sleepers dropped from 1,580 in 2020-21 to 750 in 2024-25. That's over 50% drop. I fully acknowledge the government's efforts. Now, this is a tricky problem. Some of the homeless people have public housing. They have their own homes. But because of various problems such as psychological trauma or mental health issues, they are excluded by society. They end up living in the streets, such as a lady that is really well off living in Hong Kong. She owns numerous properties and she receives rental income. In fact, this is reported in the media. Some homeless people refuse to live in shelters or hostels because they are not they don't get used to following rules, and that hostels may have privacy issues. For example, I came across this case. I helped an elderly street sleeper in To Kwa Wan apply for CSSA, but just 1 week afterwards, the street sleeper left the accommodation and ended up living on the footbridge again. I asked help from the Home Affairs Department and the FVHD. The case went on for 10 years, and in the end, family members managed to persuade him to go home. And many street sleepers have various problems, including personal hygiene problems. They also have antisocial behavior. In fact, many of them have psychological or mental issues. So the government should not only support them by providing them with basic needs, they must also help solve their mental health issues. We should take a people-centered approach and provide emotional support. For example, in terms of registration of street sleepers and data tracking, more is to be decided. We should, for example, collect data and build a database for the accommodation places so that we can draw up a waiting list. In Singapore, there is a homeless friendly policy. In Taiwan, likewise, counseling is provided. Now, these are different approaches, but both are effective. The government should make reference to the experience in these two places. We should enlist the help of professional counselors, clinical psychologists, OTs, etc., so that cross-disciplinary support can be provided. We can also draw up KPIs, and that after these street sleepers stay away from streets, we can provide long-term emotional support and counseling to them. There are also hidden cases. These street sleepers are not willing to be registered. The government should be more proactive. Counseling services should be provided. For example, voluntary workers can receive training to become counselors to provide emotional support to street sleepers, and we can designate some spots for street sleepers to go there and have a chat with volunteer workers. We can also enlist the help of psychiatric nurses in our outreach teams for early intervention. The government can also work with the business sector. Flexible job opportunities can be provided for homeless people to work in environment that is more friendly, so that we take a multi-pronged approach and keep them off the streets. I so submit.
Thank you.
Mr. Lim Chun Sing, thank you, Deputy President. According to SWD information in year 2024-25, there were 750 registered street sleepers. However, some of the homeless people were hidden cases, so I believe the actual number of homeless people is actually higher. If we look at it from a macro perspective, for registered homeless people, over 40% of them become street sleepers because they are unemployed and cannot afford the expensive rent. So they ended up on the streets. For some street sleepers, if we can reach out to them as early as possible and provide support, for example, we can provide CSSA as well as short-term accommodation to them. If we can help them address the pressing needs, we will be able to help them leave the street. For those who are capable of working or finding a job, Providing them with a safe accommodation can also help them join the workforce. In the past, some street sleepers said they were not able to provide a living address, therefore they were rejected a job by employers. They couldn't also find a place to store their personal belongings. I hope that we can adopt a case management model and provide emergency relief fund to these homeless people so that we can offer financial support to them. Then they will be able to rejoin the workforce and improve their financial status. I also hope the government will continue to strengthen its effort in tracing homeless people cases and provide follow-up support. The government should learn about their situation from time to time. If they get unemployed again, the government should offer support so that they won't go back to the street. In the long run, we have to build a safety net. We have to ensure that no one would become street sleepers just because of their financial hardship or because they are unemployed. We have to offer support to the low-income earners as well as the working population facing poverty. For those who have lost their job because they are injured at their workplace, they might also end up being on the streets because they cannot afford the expensive rent. During the COVID pandemic, the government rolled out a guarantee financing scheme for those who are underemployed. They were offered low interest loans, and these were timely relief measures for our construction workers. And it helped them tide over the tough times before they were able to find a job again. Apart from street sleepers, there are also people who live in inadequate living environment, including subdivided units in industrial buildings as well as rooftop structures. These are not authorized building structures, so if they aren't allowed to stay in those structures, they will end up being on the street again. With the basic housing unit regime, landlords will have to register their subdivided units. In the meantime, before the subdivided units are modified, will many people be forced to be displaced or forced to live on the streets? I hope the government will pay attention to these SDU tenants. I hope the government will provide more transitional housing and public housing. We don't want more people to live in inadequate living environment or become street sleepers because of the basic housing unit regime. I so submit. Thank you. Next, Mr. Chen Bui-leung. Deputy President, homelessness is a complex issue. There are various reasons that lead to homeless problem. We have to study the reasons why people become street sleepers, and we have to study how we can help them and how we can formulate homeless-friendly policies. These are things that we need to study. I speak in support of Reverend Peter KOON's motion because it gives us a chance to discuss this. According to information, over the past 5 years in Hong Kong, the number of registered street sleepers lowered from 1,580 during COVID to 750 in year 2024 and 25. The figures show that the government has offered effective support to street sleepers. For example, there are outreach teams and as well as allowances for street sleepers. However, according to our observation, there are still many street sleepers and homeless people. The current figures may not be reflecting the truth and reality. The Census and Statistics Department in its 2022 survey report mentioned that some information of street sleepers were not registered in the government system. If the street sleepers are out of touch, the registration might be cancelled. We see that there is an increasing number of street sleepers who are out of touch. Therefore, I think that the government needs to review the current computing systems that keeps the record of street sleepers information. If necessary, the government should work with NGOs as well as district care teams. It should carry out a study to study the size of unsheltered population in Hong Kong. We need a comprehensive policy after the system is built. We need policies to help the homeless rebuild their home. We want them to be able to live in peace. Over the past 5 years, however, subvented accommodation only provides 228 places. For NGOs that run on a self-financing basis, they only offer 646 places. Yao Chin Mong and Sham Shui Po are places where we see the highest number of street sleepers. According to statistics, there are 524 homeless people in these two districts. However, there are only 65 subvented places that offer short-term accommodation. I think the government needs to review subvented accommodation places to see if they are proportionate with the number of street sleepers found in those districts. While the supply of such short-term accommodation cannot meet demand, the occupancy rate of this kind of accommodation only stays at 70%. According to my understanding, 60% of this kind of accommodation can only be offered to street sleepers for a maximum of 6 months. So therefore, a lot of street sleepers are not willing to stay in this kind of accommodation. Can the period be extended from 6 months to a year so that street sleepers can stay in this kind of short-term accommodation for a longer time? There are also an increasing number of female street sleepers, so we need to offer more such subvented places to female street sleepers as well. Understand that some street sleepers, they have their homes, but they do not want to return to their homes because they face emotional problems or family problems. I agree that we should provide emotional support and counseling support to the homeless through social workers so that we can address their emotional needs. We need to help them rebuild confidence and help them reintegrate into our society. Also, we need to step up public education so that we can have more understanding of the homeless issue. We need to be open-minded and towards the homeless people in Hong Kong so that we would not label or stigmatize them. I so submit I speak in support of Reverend Peter KOON's motion as well as Ms. Ginny MAN's amendment. Next, Mr. Alan Chen. There was a saying in Chinese that we need to live in peace. It shows that the government is responsible for that. To be a civilized city, we should not focus on our economy. We also have to build infrastructure. We also have to offer support to the vulnerable groups. There are many reasons behind the problem of homelessness. It's not simply attributed to housing or other problems. I'd like to share my thoughts here. Our country in year 2026 work report, as well as in the National 15th Five-Year Plan, our country stresses that we have to provide protection to our people. We need to achieve great accomplishment in this regard. Our country has helped over 100 million people to get out of poverty. I think the SAR government should learn from our country. In recent years, we see an improvement in terms of the number of homeless people. In year 2020 to 21, there were 1,580 of them. The number is lowered to 750 in 2024-25. The Labor and Welfare Bureau, as well as the relevant departments, should be commended because of this. However, there are still homeless people who hide in fast food restaurants. So from a macro perspective, I have the following two suggestions. First, we have to address the problem at root so that we can help the grassroots to move up the social ladder. There are 111,000 SDUs and 1/4 of them will be converted into basic housing units. The purpose of the BHU policy is to improve the living environment for people. However, compliance costs will rise and landlords will pass on the costs to their tenants. They may even drive the tenants away during the transitional period. In order for the measure to be effective, the government must build a safety net and help those who are marginalized and at the grassroots so that they will not end up living on the street because they cannot afford the high rent. For Category C tenants under transitional housing, well, we have to provide accommodation for those who are living in the SDUs. I mentioned that 1/4 of the SDUs will be converted. However, do we have enough transitional housing for them? I hope the government will reserve enough resources for these tenants. Second, we need to step up our cross-departmental support. We need coordination among different government departments. In our country's work report as well as the National 15th Five-Year Plan, it is clearly stated that we need to facilitate high-quality development. We need to facilitate employment and provide psychological and mental health services. A lot of homeless people face difficulties in terms of their mental health problems and unemployment. We need the relevant support measures. The Labour and Welfare Bureau governs the welfare services in Hong Kong, and the Health Bureau looks after the healthcare system. We lack a comprehensive strategy. We should not simply distribute supplies and resources to the homeless. We need a comprehensive system. The psychiatric outreach services to be extended to the homeless people in Hong Kong. The government should step in as early as possible. The Labour Department and the ERB can chip in as well to provide upskilling services for the homeless. Again, they should intervene as early as possible. We should not only offer our compassion to the underprivileged. Instead, we should help them build their confidence and dignity so that they can reintegrate into our society. I so submit. Thank you.
Ms. Nixie Lam. Thank you, President. I thank Reverend KOON for moving this motion on formulating a comprehensive homeless-friendly policy to build a caring and inclusive society. I fully support the government's people-centered approach as the core principle in taking forward the homeless-friendly policy. Now, of course, we all want a roof over our head. We want a job to make ends meet. But for the homeless, they have financial hardship, they have family problems, they lack support. Some of them become homeless by choice. According to the statistics provided by the government in January, in 2024, 750 street sleepers were reported by the NGOs, down by over 50% comparing to the number during the COVID-19 pandemic. But as we all know, some homeless people are reluctant to approach social workers, so the NGO statistics may not fully reflect the real situation. Now, the government, as well as other social organizations, should join hands in building a more diversified support network so as to provide comprehensive support to the homeless so that they feel included and so that they will not be stigmatized. Homelessness is a complex problem. I remember when I was a Tsuen Wan district councillor, at the pier, there was a tent, and even the district council had a discussion on this matter. We proposed finding social workers to help with the situation, and in fact, the councillors then referred to a number of hotspots with tents stationed there. Is it to do with labor or housing or healthcare? We're not sure. It's a faceted problem. We need to break barriers. The government departments should break out of their silos and work together to provide one-stop support. Now, in terms of applying for government handouts, it's not as easy as it seems. For us, we can just ring a hotline and ask for help. For them, it's different. For the homeless, over half of them claim that they are unable to afford private accommodation. They cannot pay the rent because they have become homeless. And this exactly reflects that housing remains a major cause of their living on the streets. In fact, the Social Welfare Department subsidizes NGOs in helping or providing short-term accommodation to street sleepers. On average, the occupancy rate reaches 70%. Apart from temporary shelters, the government should do more. For example, under the current housing policy, the government should consider reserving units in light public housing or transitional housing for them. And there are also homeless people suffering from mental health issues to various degrees. Some are on medication. So the government should consider working with other social organizations and in districts that have more street sleepers, mobile vans should be set up to provide medical support. And we should also collect data from medical social workers as well as the SWD so that one-stop service can be provided. We should train our professionals to help street sleepers reunite with their families. And if children are involved, priority should be given for the children to receive services in subvented centers. Now, in order to build a caring and inclusive society, we all need to chip in. The homeless people are stigmatized. They all come with their own stories and background. We need to help them, tie them over the difficulties. We should also conduct reviews more actively to remove labels. For example, we should encourage organizations to run exchange programs and other activities so that members of the public can understand the homeless people better. Mr. Chang Pui-kong. I support this motion. This is a motion on formulating a comprehensive homeless-friendly policy to build a caring and inclusive society. The home is the fort for many people. This is the safe haven that we live, in which we live with dignity and love. However, in such a prosperous society as Hong Kong, we still have a group of homeless people struggling whilst they live on the streets. They do not enjoy any privacy. They do not enjoy any roof over their head. They are isolated by society. Their health conditions continue to go worse. For prolonged street sleepers, they do not have a sense of security. They even have basic hygiene problems. They have various ailments. They also have psychological traumas. Now, many homeless people suffer from mental illness, addiction problems, and other social problems. It's hard for them to reintegrate into society. I myself helped some street sleepers to my best ability, but still, homelessness is a complex problem. It involves various government departments and policy bureaus. We need to consider the matter on multiple perspectives. We need to consolidate resources through policy formulation to provide comprehensive support on the fronts of housing, welfare, employment, and healthcare. The government should consider reserving units for the homeless in transitional housing and light public housing. A quota can be set for them. And for shelters, for street sleepers, they should be allowed to stay there longer so that sufficient time can be given for them to better adapt themselves to society. According to the SWD record in 2024, 750 street sleepers were recorded. However, there are street sleepers that are reluctant to be registered. We're not sure about their whereabouts, so the actual number may be much higher. Now, according to the information provided by the electrical brief, 40% of street sleepers could not afford private rent accommodation, and there are also those who could not who simply want to save up and choose to live on the street. So financial hardship seems to be a major factor. I'm thinking perhaps we can help them find a job so that they can be self-reliant, so that they can rebuild their home. My suggestion is for the Labor Department to work with NGOs at a deeper level. A lower threshold should be adopted. Flexible modes of employment should be provided. Training should also be provided, because the homeless do not have a fixed address. They do not even have a mobile number, and they find it difficult to find a job. If we can help solve the problem, we can lay a good foundation for them to rebuild their lives. The objective of the homeless-friendly policy is to ensure that they enjoy the basic rights and dignity. In the process of seeking assistance, they would not be discriminated against. That way, we can help them rebuild their confidence and dignity. We can help solve this bomb in society so that we can build a warm and people-centric city here. I support the original motion and the amendment. Next, Mr. Alex Fan. I support Reverend Peter KOON's original motion and Ms. Ginny MAN's amendment. Homelessness is not a problem unique to Hong Kong. Well, if we take a look at the other cities around the world, Paris, so on and so forth, despite ample resources provided by the government, street sleepers seem to be a prevailing problem for these cities. Now, each homeless person comes with their own background and story. It's often very complex, such as family problems, prolonged unemployment, unable to afford rent, etc. According to the SWD statistics, in 2020-21, about 1,580 street sleepers were recorded, and then the figure came down for 5 years in a row, down to 750 in 2024-25. This shows the commitment of the government and the efforts of frontline social workers and NGOs. We need to acknowledge their efforts in tackling the issue of street sleepers. However, we need to be discerning. 750 is just the number of street sleepers registered. There are still many other street sleepers that are not registered. They are hidden in society and they are highly mobile. The second point is that despite the number dropping, we need to be able to meet the ultimate goal, and that is to have zero street sleeper. Now, we need to understand in depth the complex problem of homelessness. Some of them want to be self-reliant. Some of them are still on the dole. Some have mental health issues. Some do not have trust in our institution. We need to build a comprehensive support network so that they feel accepted. I understand that starting from 2004, the SWD has been subsidizing 3 integrated services teams for street sleepers. The teams provide outreach services, counseling, and temporary accommodation for them. Now, this is the right way to go. Starting from 2020, the government also put in more resources to hire community psychiatric nurses to provide better support. In particular, the teams target female street sleepers and provide counseling services. Female social workers and counselors are assigned to female street sleepers. This is a new service model. Now, arranging short-term temporary shelters is one thing. We need to build a better bridging mechanism for long-term accommodation to make sure that there is no gap. The government should set up a coordination mechanism. Resources should be consolidated. In the community, there are voluntary organizations providing help to street sleepers. For example, on social media platforms, we see young people give out lunch boxes, but at the moment there is a lack of central coordination, or there may be duplication of resources. The government should set up a coordination platform at the district level with the participation of care teams, NGOs, voluntary network, so as to ensure proper allocation of resources. The care teams can also play a more proactive role and enhance support for street sleepers. That means training should be provided to the care team members, especially on identifying mental health risks and enhancing the referral mechanism, so that the reporting mechanism can be enhanced and that those with mental health issues can be identified and referred as quickly as possible to prevent the problem from getting worse. Now, we need to tackle the problem at source, and that means the government should enhance public education. The issue of homelessness should be included in the CSD subject, so that we have we respect the street sleepers and do not exclude them. The government should enhance collaboration across government departments, so that we take a multi-pronged approach in building a comprehensive network. I so submit.
Ms. Rebecca Chan. Thank you, Deputy President. I speak in support of the motion moved by Reverend Peter KOON on formulating a comprehensive homeless-friendly policy to build a caring and inclusive society. With the efforts of the government and NGOs in the community, there is growing concern over the homeless in Hong Kong. People are getting more empathetic. I've been handling quite a number of cases on homelessness. Many people are quite empathetic and accommodating as long as the homeless don't obstruct public places. Usually residents are quite accommodating. However, in the community, there are some unfortunate cases. One case in Tai Kok Tsui, some street sleepers stay on the streets in the local district. Well, there are more and more street sleepers as well as miscellaneous items on the ground. And in that area, there was just a narrow passageway for passers-by. Petroleum gases as well as cooking equipment are also seen on the ground. Therefore, residents are worried about the risks of fire. This shows, despite the fact that there are quite a number of welfare policies helping the homeless, the efforts are actually scattered across different policy bureaus. That's why they are working in silos, and it's difficult to solve the problem. In the long run, this problem has become a social issue. There are more and more conflicts. Let me refer to the example in Tai Kok Tsui. If we had solved the problem at a source, then we wouldn't have had to face the ensuing problems. The homeless have been stigmatized. They have been attached with different labels. This has aroused dissatisfaction among members of the public. We need to provide more support and welfare support for the homeless, but we also need to prevent people from becoming homeless. We need to prevent these people from suffering from chronic homelessness. Some people may start off obstructing a small area, but then as time goes by, they obstruct greater space in a community. This is actually a preventable issue. That's why I go along with the amendment moved by Ms. Ginny MAN. We need to strengthen emotional support for the homeless, including the provision of psychological counseling services. Experience shows that rough sleepers have needs of emotional support or mental health. They don't know how to call out for help. That's exactly why they have developed behavioral issues. If there were outreach support for the homeless, I believe the situation would improve. And I'd like to say, once again, that homelessness is a complex issue. Every street sleeper has a different cross to bear. Housing, healthcare, mental health, emotions, all these are involved. but we shouldn't turn a blind eye to the situation just because this is a complex issue. They are part of the community. That's why we need to join hands to solve this problem. We also need to solve the problems arising from homelessness. This is exactly how we can eradicate the problem. We need to help street sleepers to find a way off the streets. There are quite a number of suggestions to help them transition into housing, but I'd like to say that there are actually different areas where we can provide assistance. For instance, we can do our level best to help them. We need to get in touch with the cases that are the least complex. Then we can help them reintegrate into society. They can then get back on their feet. Then they can be brought back into the fold. If the government could provide support to the homeless, then they can definitely reintegrate into society. This is exactly how we can eliminate stigmatization and discrimination against the homeless. Thank you, Professor Chen Wen-Kwong. Thank you, Deputy President. I thank Reverend Peter KOON for moving this motion and the amendment moved by Ms. Ginny MAN so that we can discuss homeless-friendly policy in Hong Kong. This issue has been long-standing in Hong Kong. The Home Affairs Department, Highways Department, the FEHD, the SWD, all these policy bureaus and departments are involved in tackling this issue. There are NGOs providing different types of support, such as employment support and housing support. In 2020, there were a total of 1,580 street sleepers, but then the figure has dropped to 750 recently. But actually, there could be much more street sleepers in Hong Kong because we cannot get hold of all of them, or some of them are reluctant to register. Rising rents, socioeconomic situations becoming more and more serious or complicated. Street sleepers are facing different types of issues. It is difficult to help all homeless people in Hong Kong to find a way off the streets and reintegrate into society. However, this remains our responsibility and mission. How can we better help the homeless in Hong Kong? Well, I believe we need to target the source of the problem. According to the government, unable to pay the rents owing to a lack of job. This is actually the major reason why some people have to sleep on the streets. The homeless need the roof over their head. There are short-term shelters or accommodation providing housing options for the homeless until they can transition into housing. But the longest period for street sleepers to stay in these accommodation options is 6 months. Afterwards, homeless people find it difficult to transition into housing, and they will relapse into homelessness because of the fact that they couldn't afford high rents. Some people even choose to stay on the street for a long time. With a downward trend in the number of rough sleepers in the streets, I hope that the government can discuss it with NGOs and operators to help the homeless to transition into appropriate housing. The government should also explore the use of long-time vacant school premises to provide housing options for the homeless. This is how we can provide housing options for the homeless. At the same time, we can also prevent wastage of land resources. In addition, employment support also matters. I believe the government can draw reference from the Good Employers Charter. Enterprises can be encouraged to provide job opportunities for the homeless. Meanwhile, training programs could be provided to the homeless. There could be targeted support in relation to skills that they need. CV preparation, interview preparation. We need to provide support for the homeless. We also need to help the homeless to get a hold of an address proof. This is exactly how they can integrate into society again. The original motion refers to enhanced public education and publicity in order to destigmatize the homeless. I agree with this. But at the same time, we must face up to the situation. We need to reduce nuisance to residents nearby. I believe we all feel this. Street sleepers stay in the same location when they sleep, have a meal, and move around. That's why some places have turned into hygiene black spots. This makes it easy to spread germs and diseases. There might even be security loopholes. That's why residents nearby have grown dissatisfied with the homeless. They may even become antagonistic towards the homeless. We need to prevent this situation. We need to reduce nuisance caused to residents living nearby. This is exactly how we can solve the problem, and this is how we can foster social cohesion and social harmony. Thank you. Mr. Andrew Lam. I thank Reverend Peter KOON for moving this motion. Mr. Lam, please clip your mic onto the lapel of your jacket. Thank you, Deputy President. A lot of places have homeless people on the streets. Every street sleeper has a cross to bear. Some people do not have their home, while some have their home, but then they could not return to their own homes. Street sleeping is a complex social issue. We need to rely on NGOs and integrated service teams to tackle the problem. We need to build rapport with street sleepers. We need to find out what they need. This is exactly how we can provide targeted support. Some people criticize government policies for not being well-rounded enough. In 2022, the Audit Commission released a report on support services for the homeless. The report covered different issues, such as accommodation issues, system management issues, and so on. Starting from 1981, the SWD has already set up a system that is a computerized registry of street sleepers. However, the audit report shows that the system fails to reflect the real situation in the community. We see the results of data silos. However, we can turn risks or crises into opportunities. Nowadays in Hong Kong, we promote the use of a smart city and data governance. We need to turn the static computerized registry to a dynamic database with connections. We need to accurately identify street sleepers to help them, to get a hold of them, and to provide targeted support. We need to optimize the use of public resources to build an effective and an efficient safety net. We need to show our human touch and human care. I believe there are three main points. One, we need to dynamically trace street sleepers in Hong Kong. For example, we can track the use of autobus cards, clinic attendance record, as well as the receipt of public allowances. When some cases are not updated over a protracted period of time, this case should be flagged for service teams to conduct visits. We need to get a hold of the homeless who haven't shown up for a long time. Two, we need to optimize the use of a system. For example, we need to make good use of the data of street sleepers, such as gender, age, physical condition, where they work, and so on. We need to make good use of algorithms to provide the most targeted support. Well, when social welfare workers should step in order to provide timely support for street sleepers. Service teams need to spend a lot of time on paperwork and communication across different departments. When we have a uniform platform, then we can provide a one-stop shop regarding different types of information, such as housing, welfare, health care. This will significantly reduce administrative costs. But social welfare workers can also devote the most resources to street sleepers. They can build good rapport with rough sleepers. I have been advocating the principle of data following the user. I thank the government mentioning in the budget for using government internal statistics. I expect that different types of statistics can be consolidated within the government database. Service users or operators should have a good understanding of the situation of street sleepers. We need to turn from being passive to being active. We need to prevent the situation from worsening. Thank you.
Ms. Elaine Chick. Thank you, Deputy President. I am a member that looks after social welfare issues under the DAB. I am a member representing the Hong Kong Island East constituency. I try to put myself in the shoes of the homeless. I think a lot of people, they become homeless because they cannot afford the expensive rent. Some of them, after they are discharged from the hospitals, after they're released from the prison, they do not have a home and they end up being on the street. And so the government needs to step in. As a GC member, I am concerned about I'm concerned about the homelessness issue because it gives rise to safety issues as well as hygiene issues. It is not constructive simply to kick out the homeless people. I think we need to formulate homeless-friendly policy. We have to balance the interests of various stakeholders and at the same time protect the interests of the homeless. I hope that we can genuinely support the homeless so that we can help them address their problems at source. There is a homeless person who have lived on the street for 10 years, and he had lived in KOON for many years, and he ended up helping some 200 other homeless people. He said the homeless people would like the respect of all of us, and therefore he always distributes clean supplies and resources to the homeless people, and he also helps take care of the female homeless people. From this story, we know that we have to genuinely support the homeless. The homeless people have been discriminated against for a long time, and so we need to offer them emotional support. I think we need to adopt a case management model. We need to follow up on these cases, offer emotional support to the homeless first. After they have received the care as well as the emotional support, then we can help them rebuild their personal networks. After that, we have to take care of the housing problem. A lot of homeless people, they end up being on the street because they do not have a home. There is some interim housing services provided to the homeless. However, the homeless people can often only stay there for 6 months. We need to extend this period, and also the government may study turning some transitional housing as well as some light public housing units into short-term accommodation for the homeless so that the homeless people can live in peace. Homelessness is a complicated issue. We have to take care of the welfare needs, healthcare support required by the homeless. We need to coordinate the efforts of various policy bureaus so that we can formulate a comprehensive homeless-friendly policy. As for the amendment to the motion, it states that we need to offer mental health support as well as psychological counseling to the homeless so that they can get more comprehensive support from us. I submit I speak in support of the motion and the amendment. Next, Mr. Ken Wong. We need to take care of the needs of the homeless. For example, the SWD has formed the integrated services teams for street sleepers, and it also provides case referral services. It provides urgent and short-term accommodation as well as emergency funds to the homeless. During cold weather, the HAD opened shelters for the homeless, and it provides hot meals as well as hot water for free to the homeless to take care of the needs of the vulnerable. The SWD also, through a central register, grasps the trends of homelessness problem. According to data over the past 5 years, last year the number of registered street sleepers has dropped to half of that of 5 years ago. So we see a downward trend. While we commend the efforts made by the government, we have to prevent the problem of homelessness by coming up with homeless-friendly policy. I have the following 3 suggestions. First, we have to attach importance to emotional support for the homeless. Homeless people, they do not only lack a home, they also face emotional distress, trauma, as well as mental health problems. On top of the outreach services as well as short-term accommodation provided for the homeless, the government should provide counseling support and emotional support as well. For example, at short-term accommodation as well as at shelter centers, there needs to be counseling support and emotional support services. The government, if need be, can refer any severe cases to the healthcare system. We should dynamically track these cases so that we can offer follow-up services on a continuous basis. Second, we need to create jobs. The Labor Department as well as the ERB can provide this support. According to statistics, Yau Chin Mong, Sham Shui Po, and Wan Chai are 3 districts with the highest concentration of homeless people. A lot of these homeless people are unemployed and they have debt to pay. I hope we can offer support to them in a targeted manner so the LD as well as employers can work together. We can offer jobs to the homeless people so that they can work as cleaning workers, security guards, or in the catering or logistics sector. We should offer transitional support to them so they can slowly rebuild their lives. Also, we need to identify any street sleepers early. We need social workers, schools, as well as the healthcare professionals to identify any high-risk households or families. The key is that we need to prevent by early identification. We should learn about student situations. We should make use of our social workers network. We have to build a case referral mechanism for high-risk families or households with family members with violent tendencies or psychological or psychiatric problems. We need to offer early support to them so that they won't become street sleepers. This is the direction that the government has been taking through the outreach services as well as through the provision of accommodation. However, we need a better closed-looped mechanism. Homeless people need resources and supplies, but at the same time, they also need mental support. In the short term, they need emergency relief support, and in the long run, we need to dynamically trace any homeless people's cases, so that we can, in a more systematic manner, provide more comprehensive and effective support to the homeless. I so submit. I speak in support of the motion. Next, Ms. Grace Chan. I speak in support of Reverend Peter KOON's motion as well as Ms. Ginny MAN's amendment. The government, in dealing with the homelessness problem, they have to adopt an evidence-based approach so that we can formulate effective and sustainable policies. I'd like to speak about the implementation of services. First, on consolidating data and sharing of data. Currently, the support system of the SWD does not cover enough data. This would affect the provision of services. Therefore, a lot of members just now mentioned that there needs to be a cross-departmental information platform. We can, in a systematic manner, consolidate data from family service centers as well as data from integrated services team for street sleepers. We should provide incentives for the homeless people so that they would provide their information to the government. There are organizations that provide free dental services. We can make use of these services to offer incentives to the homeless people to provide the information in order to ensure the accuracy of our database. Now, on temporary shelters. In the past, the government has tried opening these shelters for long hours. Indeed, there is a need for such services. However, in 2021, the HAD opened its shelter or centers for a month, and the government got very good and positive feedback. This is a cost-effective way to respond to the needs of the homeless people. Thirdly, on the time that homeless people can stay in short-term accommodation. As mentioned, from a service user's perspectives, there are loopholes to the system. This is because they can only stay there for 6 months, and the homeless people, after getting into the accommodation, we need time to help them, for example, find a job and help them build the saving habit. So 6 months is not enough for us to help them build a stable life. Therefore, while they are facing, for example, a positive change, they need to at the same time move out of the short-term accommodation. I think there needs to be more a reasonable arrangement to allow homeless people to stay in the accommodation for a longer time, and that would allow more time for relevant organizations to offer support to the homeless people, and that would ensure a better service quality as well. Now, I'd like to turn to the question about hoarding. This is not just an environmental hygiene issue. It has to do with the mental problem or mental state of the homeless as well. We've just rolled out this kind of support services, and it's hard for us to respond to the demand for these services. The government may regularize this service by setting up support teams. It should work with the social welfare sector, healthcare sector, as well as housing professionals, so that there could be comprehensive support offered by the government and the relevant sectors. We can this way offer more systematic support to address any hoarding behaviors of the homeless. President, I hope that we can adopt a multi-pronged approach to formulate homeless-friendly policy. We need to adopt a more targeted approach to allocate resources. Then we can build a truly caring and inclusive society. Thank you.
Mr. Chen Pok-chi. President, Hong Kong is an inclusive society. Formulating homeless-friendly policy can protect the underprivileged and enhance social cohesion. It's also a demonstration of the core value of our society, which is social equality. Now, for the homeless, they face various problems. It's not just about the lack of a roof over their head. It's also about their physical and mental health as well as self-reliance. So we need to build a comprehensive support network to help lift them out of their plight and rebuild their confidence. At this current stage, we can enhance existing service layout and plug gaps so that comprehensive and people-oriented services can be provided. With joint efforts, we can build a stronger network for the homeless, so that they feel that our society cares about them, so that they can reintegrate into our society. According to a survey, over 40% of street sleepers displayed emotional problems, but about 20% have received mental health services. It takes a long time for a follow-up appointment to be made, and that is a disincentive. We should roll out enhancement measures to enhance the support network for the homeless and help them rebuild their lives. For example, in terms of temporary accommodation, we should make good use of transitional housing resources, and we should provide greater flexibility on the length of stay in temporary accommodation to prevent the gap from arising. Professional social workers and healthcare teams should be engaged to follow up on the emotional needs of the homeless. This can help rebuild their confidence. We should enhance their mental resilience. And in that sense, the hospital authority can work with social organizations and provide run mobile vans to provide mental health support services at the community level. Free consultation sessions should be provided. The third point is to enhance employment support. That should be government, business, social collaboration to provide job training for the homeless. Job subsidies should be provided as well. We should encourage employers to provide equal opportunities for the job seekers so that they can be financially self-reliant and so that they can find values in themselves. We should also promote cross-departmental collaboration. And I believe the Social Welfare Department, Hospital Authority, Housing Department, and Home Affairs Department are involved in solving the homelessness problem. We should enhance the coordination and cooperation mechanism. We can leverage on the NGOs in terms of their resources and their advantages. Next, we can also enhance public education and publicity so as to address public misconceptions. And we can encourage the public to be more inclusive so that inclusiveness and care can be shown to the homeless and that they can truly integrate into our society so that they can feel the warmth of our city. We put people first. It is our responsibility to make sure that people live in dignity. The DAB supports the motion on formulating comprehensive homeless-friendly policy, not only to solve the problem of homelessness, but also to demonstrate that Hong Kong is a caring and inclusive society. I support the motion and the amendments. Mr. Scott Lau. Thank you, President. I support the motion and the amendment in principle. Homelessness is a complex problem. According to media reports, the homeless people usually face various problems such as poverty, joblessness, mental health and physical health problems, poor family relationships, etc. It's difficult to put in place a single policy that can solve the problem. We need to build a framework to help the homeless people. Of course, as the title suggests, we should formulate a comprehensive homeless-friendly policy. I support that in principle. However, we also need to face squarely the problem of nuisance brought about by street sleepers to the community. We must not be idealistic and ignore what happens in reality. In the community, there are some long-standing problems that are not tackled. For example, prolonged occupation of public places, the street sleepers soiling the place, the hoarding, drugs, violence, etc. These are not just talk shop. These are problems facing residents in the community day in, day out. Now, I lived and studied in Yaochimong area, and I'm a district councillor of Kowloon West and Sham Shui Po. Let me be frank. Every day we see drug addicts, we see street sleepers soiling the street. They answer the call of nature in the street. Now, as we say, we don't want to put labels on them, but in reality, these are exactly the problems. If you just go to Tung Chau Street Park or the footbridge at Nam Chang Street or the Cherry Street subway, you will see these problems for yourselves. So whilst I agree that we must not discriminate against the homeless, we should make sure that our community is not affected by the problems that they bring about. We should strike a balance. So in principle, I support the original motion. The concept is good, but we need to address social issues as well, such as environmental hygiene, obstruction of public place, as well as drugs and other law and order issues. Now, we have conducted studies on providing short-term accommodation and other measures to support the street sleepers, but these are not effective. This is a recurring problem. Street sleepers very often would leave the street only to go back later on. For example, between 2014 and 2016, Sham Shui Po District Council made use of funds under a pilot scheme that is district-based to engage outreach teams to follow up on the cases of street sleepers. Now, support was provided. Indeed, some street sleepers eventually left the street. If we take a people-centered approach, we can indeed help them. But the government should take a two-pronged approach. On one prong, the government should enhance personalized support, including counseling, healthcare support, and long-term accommodation. On the other hand, there should be a regulation mechanism for acts involving obstruction of public places, environmental hygiene, or even crimes. We should ask the relevant law enforcement agencies to take action and step in as quickly as possible. Caring and inclusive society is one thing. We at the same time must safeguard every citizen's rights. I hope that the government can draw up measures so that we have a warm society and that the street sleepers will be able to find a roof over their head while the community remains unaffected. Mr. Vincent Chang, I personally speak in support of Reverend KOON's motion and the amendment. When it comes to supporting the homeless or homeless-friendly policy, we're talking about a very wide scope. According to statistics on street sleepers, in 2020-21, there were 1,580. In 2024-25, the figure came down to 750. So that's a drop. I believe this is due to the work of the integrated services team, the care teams, as well as NGOs and frontline social workers. Now, when it comes to district work, however, in Sham Shui Po and Yaochimong, when you go to parks or the footbridges, you see street sleepers. And we also receive complaints from local residents about the occupation of public space as well as hygiene issues. Like Mr. Scott Leung mentioned, I fully agree that these are actual problems. People have the right to use the park, but then the park is often occupied by street sleepers. According to statistics, there are different reasons why the homeless would take shelter in the street. We need to tackle the problem at source. Housing is a major cause. However, the problem is much more complex than that. We cannot just increase our housing supply. For some homeless people, they may have a job, and because of the location, they may choose to just stay overnight in a park somewhere in the city instead of the rural areas. Some want to save costs, and some have emotional problems or problems with their families. Some have drug addiction. About the definition of the homeless is a very wide one, according to academic discussions. Now, the homeless include those sleeping in the streets, and also those staying overnight in fast food restaurants or living in inadequate living conditions. We need to find a way to support them. A comprehensive approach should be taken to help them integrate in society and keep them off the streets. At the same time, we can improve their personal hygiene, their safety, etc. Because after all, it's a social conflict. I have the following suggestions. We should enhance support for the street sleepers. This cannot be done only by providing accommodation, but at least if they're able to get a roof over their head, we can solve part of the problem. Now, in fact, I handled a case involving a hostel for singletons. The occupancy rate is never 100%. The singleton hostels are perfect for street sleepers. Why aren't street sleepers going there? Has it to do with the policy? Can we improve the policy to encourage more street sleepers to go there? The second point is to enhance healthcare and mental support for street sleepers. Many of them suffer from various ailments or have mental health issues. Some of them are drug addicts. According to a local survey, 60% of street sleepers are afraid of their mobile phones being stolen. They'd rather not have mobile phones at all, and not many of them have fixed address. They don't have mobile phones, so they don't get informed when time is up for them to visit the clinic again. We want to enhance support for them in this regard. We need frontline social workers to collaborate with us so that a cross-departmental mechanism can be set up and that the homeless can get timely help or counseling. The third point is about social welfare and healthcare. Resources should be consolidated as suggested in the original motion. A dedicated team can be set up to help the homeless so that we consolidate policies and take up cases through referral. The government and the NGOs should join hands in removing labels on the homeless people and help them reintegrate in society. Now, what is crucial is to help them rebuild confidence and enhance their social cohesion. I hope that the government can enhance cross-departmental collaboration to solve the problem. I so submit.
其他
Does any other member wish to speak? Reverend Peter KOON, you may now speak on the amendment. Deputy President, I thank Ms. Ginny MAN for making the amendment. The amendment helps enrich the content of the original motion. I also thank the other members for their valuable insights. The amendment urges the SAR government to save up to the severity of the homelessness people in Hong Kong and formulate a cross-departmental and multidimensional homeless-friendly policy using a people-centered approach. The amendment proposes that the government strengthen emotional support for the homeless. It encourages the business sector, religious groups, and community organizations, as well as charitable bodies to participate jointly in establishing a support network so as to help the homeless to rebuild their confidence and dignity. A lot of the existing support focuses on providing temporary accommodation for the homeless. However, as mentioned by a lot of members, this is a complicated issue. Homeless people become street sleepers because they are unemployed, because they have a broken family, and it could also be because they are facing mental problems. They have lost their self-confidence as well as hope and dignity. So just by providing accommodation support would not help them get out of the plight and rebuild their lives. We need to strengthen emotional support for the homeless, and that covers providing psychological counseling services. And this is indispensable if we want to build a comprehensive support system. Here I'd like to urge the relevant government departments, the relevant social welfare organizations and charitable groups to build a diversified and collaborative support network together so that we can offer more comprehensive counseling and psychological support services to the homeless. There could be many measures that we can implement. I'm not going to go into the details here. For frontline staff that are in touch with the homeless, we need to provide them with counseling training and first aid training so that they are capable of identifying early any high-risk cases. Also, social welfare organizations and charitable groups are the ones that understand the situation of the homeless the most. So they should serve as a bridge. We should support these organizations to provide more diversified services and organize various inclusive events. For example, interest groups to help the homeless reintegrate into our society. We should let the homeless feel the care and love we provide for them so that they can be reconnected to the community and that they will have a sense of belonging. The amendment made by Ms. Ginny MAN help enrich the original motion. So I speak in support of the amendment. I urge all members to support the original motion and the amendment as well.
Undersecretary for Health. President, I thank members who have spoken on the motion on homeless-friendly policy. I'm going to speak on the government's policies and work on healthcare services for the homeless. The government is committed to providing quality and affordable healthcare services for Hong Kong residents, including the underprivileged, such as the homeless, by advancing healthcare reform and optimizing resource allocation. We aim to make sure that residents will not be deprived of healthcare services due to financial reasons, because public healthcare is the cornerstone of Hong Kong's healthcare system. It's a safety net for all. Healthcare services under the Hospital Authority includes A&E services, GOPCs, and SOPCs in public hospitals. They provide appropriate treatment and supporting healthcare services based on the clinical conditions and healthcare needs. Patients, including the homeless who are unable to afford healthcare service charges due to financial difficulties, may apply for fee waivers through the medical social service units at public hospitals and clinics, the integrated family service centers of the social welfare department, or the family and child protective services unit. We have family medicine outpatient services and other community services provided by the Hospital Authority and the Primary Health Care Commission, such as the district health centers. They deliver community-based primary healthcare services, including management of chronic diseases such as diabetes, hypertension, episodic illnesses such as flu, and nursing services such as injection and wound dressing. Service users mainly include the elderly and low-income individuals, patients with chronic illnesses. Homeless persons are also eligible. Now, any homeless person with heroin or other opioid drug dependence may apply to join the methadone treatment program. Patients in the program are not required to have referral, nor do they need a detailed registered address to access the service. This program provides harm reduction measures for suitable patients, such as free HIV and viral hepatitis testing, various vaccination services, as well as counseling, psychosocial support, and case management by social workers. Patients may also be referred as appropriate to other drug treatment service agencies, such as inpatient drug treatment at the Society for the Aid and Rehabilitation of Drug Abusers or other forms of treatment. Now, the Department of Health operates 11 government dental clinics providing emergency dental services free of charge to the eligible, including acute mental problems, pain relief medication, oral abscesses, tooth extraction. Homeless people are also eligible. The next is Community Dental Support Scheme. Starting from the 1st of January 2026, it replaces the Elderly Dental Assistance Program under the Community Care Fund. The scheme provides dental checkups, scaling, fillings, tooth extraction, root canal treatment, RCT, removal of dental bridges and crowns, and provision of removable dentures for the underprivileged and the homeless with financial difficulties. The scheme covers homeless persons. NGOs would identify and assist those in need through their service networks. Social workers will also help with documentation, contacting dental clinics to apply for services, and arranging appointments. The support scheme leverages the network of NGOs and social workers to provide assistance to ensure that the disadvantaged group will receive appropriate dental support under the principle of prevention, early detection, and early treatment. Eligible persons may also benefit from government-subsidized Chinese medicine services, including the 18 district Chinese medicine clinics, training and research centers, the Chinese Medicine Hospital of Hong Kong, and district health centers. The government also has the elderly healthcare voucher scheme. It provides financial incentive for the elderly to choose private primary healthcare services that suit their needs. No means testing is required. The homeless persons may also make use of the vouchers to access services and improve their health. Street sleeping is a complex social issue that requires cross-bureau and interdepartmental collaboration. It's not just limited to healthcare support. The Health Bureau will actively work with the departments concerned to ensure that the homeless can access appropriate health care through the existing public healthcare system to help them maintain their health and improve the quality of life. I so submit.
副局長。
Undersecretary for Housing. Deputy President, I thank Reverend Peter KOON for the motion, Ms. Ginny MAN for the amendment, as well as the other members who spoke on the motion. I thank members for their concerns regarding the situation of the homeless and for offering many valuable suggestions. I'll talk about 5 relevant housing measures in response. That includes light public housing scheme, transitional housing, temporary shelters, as well as interim and basic housing units. Housing is a top priority for the current term government. To enhance citizens' sense of well-being and fulfillment, we're making every effort to advance our work related to housing. We have already identified sufficient land to meet the target of supplying 294,000 public housing units over the next decade. Including light public housing units, the total public housing supply over the next 5 years will be about 196,000 units. This is an increase of over 80% compared to the 5-year period from the start of the current term government. As of the end of December 2025, there were about 106,300 general applications for PRH. Under the quota and point system, there were about 81,500 non-elderly one-person applications. These two figures have dropped by over 30% and 40% respectively compared to their peak levels. The decline in non-elderly one-person applications from those under 30 is even more prominent. The number has plunged by 60% over the past decade from 74,500 to 29,500. This shows that the PRH waiting list is being shortened. To fill the supply gap in public housing, under the LPH scheme, there are 7 projects. A total of 9,650 units have been completed under these projects, and they are now fully occupied. We expect that this year and early next year, about 20,200 and 200 units will be completed respectively. We will achieve the target of building 30,000 LPH units. Also, the 3rd round of applications for LPH opened this year. This round covers 4 projects offering 8,820 units. Residents are expected to move in starting from Q2 this year. The response to the LPH scheme has been overwhelming, with the number of applications received to date exceeding 32,150. On transitional housing, the Housing Bureau has rolled out 20,900 units. It is expected that in the first half of this year, an additional 220 units will be completed in the urban area. We'll exceed the original target of building 20,000 units. Like LPH, transitional housing does not only provide short-term shelter. The operating organizations offer various social support services, such as social work, counseling, elderly support, and vocational training. These comprehensive services help grassroots residents enhance their life skills, build community networks, move up the social ladder, thereby fostering a caring and inclusive community. LPH and transitional housing both cover allowance scheme. So financially speaking, we are helping residents that move into this kind of housing to move into new living environments. In response to the increased allocation of traditional public housing, we're able to improve people's living environment, lower their rental burden, and start a better life. LPH households can save about $4,000 per month in terms of rent, and for transitional housing residents, they can save $2,900 per month. The above initiatives offer support to 30,000 and 20,000 low-income families respectively over a 5-year period. That means a total of $11 billion can be returned to the people, truly sharing the fruits of Hong Kong's economic development with all citizens. In response to the increased allocation of traditional public housing, the first 2 LPH projects have achieved a turnover rate of 102% within just 6 to 9 months of operation this year, with 200 households successfully moving out after being allocated traditional public housing. The turnover rate for transitional housing units is also high, with the occupancy rate exceeding 140% in multiple projects. As of the end of February this year, the total number of tenants who have successfully moved into public housing units has reached 3,050. In addition to being allocated traditional public housing, there are cases where tenants have saved the rent and they were able to move into HOS flats. Also, the government offers the compassionate rehousing scheme for those who have genuine and urgent housing needs. If there are no other possible ways to resolve their housing problems, they may seek help from the Social Welfare Department. Once the SWD confirms the genuine need, it will recommend the application to the Housing Department. Upon receiving the recommendation, the Housing Department will arrange a suitable public housing unit after the eligibility verification process is completed. In 2025-26, the Housing Department received 350 cases referred by the SWD. Also, the government provides temporary shelters free of charge as a short-term accommodation for the homeless. During their stay, residents may continue to seek alternative housing options on their own or await eligibility assessment for PRH. If an individual has resided in a temporary shelter for 3 months, passes the homelessness assessment, which proves that they have no other places to live in and that they meet the eligibility criteria for public housing, the Housing Department will arrange for them to move into transitional housing. The current term government is determined to resolve the long-standing housing issue in Hong Kong. Starting from the 1st of March this year, we are allowing subdivided unit landlords to get registration. We provide a 48-month transitional arrangement. We want SDU landlords to provide a safe and adequate living environment for their tenants. Whether the existing SDUs meet the standards or not, we welcome the free registration so that they get exempted during the transitional period. There are 6 district care teams that are offering comprehensive support. They will help deal with any discussions that need to take place between landlords and their tenants on the transitional arrangement. For Category C transitional housing, they will be offered as a safety net for SDU tenants to make sure that SDU tenants will not be displaced or become homeless. We're offering short-term, medium-term, and long-term measures to safeguard the basic housing needs of all citizens, including the homeless. We're improving the public housing system comprehensively, enhancing citizens' sense of well-being so that we can build a caring and inclusive society. Thank you.
Secretary for Labor and Welfare. President, once again I thank Reverend Peter KOON for moving this motion, Ms. Ginny MAN for her amendment, and altogether 17 members who have offered valuable views on how the government can tackle this issue. Street sleepers, otherwise known as the homeless. This is a complex social issue cutting across different policy bureaus and departments. That's why the Health Bureau and the Housing Bureau spoke just now on housing and healthcare needs. I'm going to focus on 3 areas. 1. Outreach services of the integrated services teams for street sleepers. 2. Accommodation and employment support. And 3. Cross-departmental joint operations coordinated by the district offices. I'm going to address members' views on these 3 fronts. First of all, regarding the integrated services teams for street sleepers, since 2004, that is 22 years ago, the SWD has subvented NGOs to operate 3 integrated services teams for street sleepers, providing territory-wide integrated services. The teams comprise social workers and psychiatric nurses. They conduct daytime and late-night outreaching visits. They proactively engage with street sleepers. They need to build good rapport with these street sleepers in order to gain insights into their reasons for homelessness. They also provide services in light of their actual needs and willingness to accept assistance. These include counseling, service referrals, short-term accommodation, and applications for emergency financial assistance to cover rent, rental deposits, and living expenses. The purpose is to build trust, connect them with community resources, and help them transition into housing as early as possible. Just now, some members refer to a computerized registry of street sleepers operated by the SWD. It covers NGOs, subvented organizations, as well as the data provided by these units. The relevant social welfare workers will reach out to street sleepers, and then they will make professional assessments of their needs. The relevant data will be entered into the system. Since 2023, the SWD has requested service operators and service units to review the cases of street sleepers. Regular updates need to be made. The reason is that we need to, in a more accurate manner, have a grasp of street sleepers in Hong Kong. In addition, social workers of the teams and short-term hostels help street sleepers to secure more stable housing subject to their wishes and circumstances. This may include renting private housing, referral for elderly homes, and other housing assistance schemes such as social housing, the shared housing scheme, and co-living projects funded by charitable organizations with a view to helping them to reintegrate into society. On accommodation and employment support, to meet the accommodation needs of street sleepers, the SWD subvents NGOs to operate short-term hostels, providing transitional accommodation alongside counseling and advisory services to facilitate a move to a more stable housing. All over Hong Kong, there are a total of 6 subvented hostels located in Mong Kok, Sham Shui Po, Wong Tai Sin, Hong Hom, Wan Chai, and Chai Wan. They serve street sleepers across the city. Some members just now spoke on female hostels. I'd like to share with you some statistics. By gender, just a little under 20% of street sleepers are females. Over 80% are male street sleepers. There are many more male street sleepers than females. However, a quarter of the hostel places are for females. 3/4 of the number of hostel places are for males. This shows that we understand the needs of female street sleepers, which are different from those of male street sleepers. These hostels are staffed with social workers. Social workers can remain in communication with street sleepers. Social workers help them to transition to long-term housing arrangements. Street sleepers have different needs and different reasons for staying on the streets. We hope to improve their socializing skills, build their own mutual assistance network so that they can reintegrate into society for a better life. Just now, some members referred to the maximum period of staying in the hostel, that is 6 months. We need to balance two major factors. One, within this period, do we have sufficient hostel places for street sleepers? We also need to take into account the wait for these hostel places. If we allow every street sleeper to stay for a very long period of time, of course, that is good to the staying in street sleepers, but what about those on the wait? After all, we need to strike a balance between street sleepers in hostels and those on the waiting list. We have already taken into account different factors before we came to this arrangement. Regarding how we can help the homeless to secure a job, social workers provide tailored support based on individual needs and aspirations. This includes employment support and skills groups, short-term transport allowances, and we also work with the Employees Retraining Board. We make referrals to enable the homeless to undergo training, enter the labor market to once again secure a job, and to keep upskilling themselves. On the joint operations coordinated by district officers, among the 19 members who have spoken just now, 17 members altogether spoke from the perspective of social welfare. Mr. Vincent Chang and Mr. Scott Leung spoke from the perspective of the district level. They are from the Kowloon West constituency. The vast majority of street sleepers are concentrated in two districts, that is, Sham Shui Po and the Yau Tin Mall district. As I mentioned, homelessness is a complex issue. Emotional support, family issues. Every street sleeper has a cross to bear. Sometimes we see conflicts between the reasons for homelessness and district issues such as public nuisance. We need to understand the plight of street sleepers, but we also need to understand the concerns of residents in the locality. In this regard, district officers will, in response to local concerns or complaints about environmental hygiene at street sleeping locations, coordinate cross-departmental joint operations as appropriate. For instance, upon receiving complaints or district views, the DOs, that is, district officers, will arrange site inspections and conduct a preliminary assessment. Relevant departments will then be engaged for follow-up actions. For example, the Food and Environmental Hygiene Department is responsible for handling environmental hygiene issues. With regard to more complex cases involving multiple departments, the DOs will coordinate different parties, including the SWD, FEHD, the Lands Department, and the police, to work out the details of joint operations in light of the district's actual circumstances. Each department provides support within their respective remits. Street sleeping is more than a mere hygiene issue. In addressing this challenge, departments and district service units have all along worked closely together. They adopt a compassionate and humane approach. On the one hand, we attend to the needs of street sleepers, provide appropriate support with the aim of helping them to transition into housing and reintegrate into society. On the other hand, we arrange for the prompt clearance of refuse structures at the locations concerned with a view to reducing nuisance to nearby residents. Before a cross-departmental joint operation coordinated by the DO is carried out, the SWD will, together with NGOs and the Integrated Services Teams for Street Sleepers, proactively visit street sleepers in the district to find out their reasons for sleeping rough and their needs. Through counseling from different angles, They identify and address welfare needs early. They also tie in with the DO's coordinated clearance actions. During outreaching visits, if medical or mental health needs are identified, social workers will arrange referrals to appropriate medical and support services, which include psychological and psychiatric treatment, drug rehabilitation services, and counseling for gambling or alcohol addiction. On the day of the operation, the SWD staff will also be present to attend to the emotional and psychological needs of street sleepers. They also provide further welfare support in accordance with their wishes. The DOs will continue to work closely with relevant departments to properly address district concerns arising from street sleeping. President, by and large, street sleeping is indeed a complex social issue. The SWD and welfare organizations will continue to provide welfare support services to help street sleepers to reintegrate into society. We believe that the current support framework can meet the overall needs of street sleepers from the perspective of welfare. The relevant bureaus and departments will continue to closely monitor the situation and take appropriate measures, including working in partnership with NGOs and district organizations to support street sleepers and build a caring and inclusive community. Thank you, President.
I now call upon Ms. Ginny MAN to move an amendment. Ms. Ginny MAN. President, I move my amendment. I propose the question to you that the amendment moved by Ms. Ginny MAN be passed. I now put the question to you as stated. Will members please proceed to vote? Members, please press the present button. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present, that is, those returned by the election committee and those returned by functional constituencies and geographical constituencies. I declare the amendment passed. Reverend Peter KOON, you still have 45 seconds to reply, then the debate will come to a close. President, the homelessness problem is very complicated and a lot of stakeholders are involved, including district personality. I raised this topic because I want all of us to be concerned about this. The government is taking an executive-led approach. I believe that with the concerted efforts as well as the government's effort, we will be able to improve the situation. I so submit. I hope that you will support my motion. I now put the question to you that the motion moved by Reverend Peter KOON as amended by Ms. Ginny MAN be passed. Will members please proceed to vote? Members, please press the present button. Will those in favor please raise their hands? Those against, please raise their hands. I think the question is agreed by a majority of each of the two groups of members present, that is, those returned by the election committee and those returned by functional constituencies and geographical constituencies. I declare the motion as amended passed.